Nigeria's health sector has been grappling with the issue of brain drain. The country's healthcare system is losing a significant number of skilled and talented medical professionals who are seeking opportunities abroad. This has posed a severe threat to Nigeria's ability to provide quality healthcare to its citizens. The Provost, Lagos State University College of Medicine, Professor Abiodun Adewuya, says medical professionals should look past the monetary gains and strive to make an impact, while urging the government to provide a conducive environment for medical professionals to work.
One, make sure that the atmosphere here is very conducive for our people to thrive. It is not likely in the next 5, 10 years that our government will be able to pay as much as people over there are paying. But if we let our new graduates know that it's not only about money, it's about making an impact in the people that you belong to, and making an impact in your own environment, making sure that the money the government spends on you don't use it, the knowledge gain for somebody else, that you invest in young people. I think a change in the orientation will come. Like I said, it's going to take a long while for us to expect that Nigeria will pay the same amount of money to a doctor, to a nurse, as UK or US or Canada. There is a payment bandwidth, which is just like in journalism. You can't compare your own. So I think that is one thing. Another thing is to make sure that we invest more in healthcare so that professionals that decide to stay back will enjoy what they do here.
Many Nigerians are worried that, if left unchecked, migration of healthcare workers to seek greener pastures may adversely affect healthcare delivery in Nigeria. Dr. Taiwo Adeyeye is the Managing Director and Chief Executive Officer of Amuwo Odofin Maternal and Child Center, Amuwo MCC, and he says the brain drain in the health sector has not affected the quality of services rendered to patients, as the center has been able to keep a good number of its doctors.
We are not having critical shortage at the moment. Reason being that in the last few months, the Health Service Commission has actually employed more health personnel to fill the gap created by those who are leaving the country. So, although we still have one or two leaving, even in the last few months, but still the number is we are still able to cope with their patient, with their clients, with the number we have on ground. So the Health Service Commission has actually done a good job in replacing those who have gone away at this particular time.
Though the center is not faced with a shortage of medical doctors, Dr. Adeyeye, however, says they are experiencing a shortage of nurses.
In fact, I would say that the area where we had serious shortage was even in nursing departments. As I've said, for the medical doctors, I don't know, we've been blessed with Amuwo in the sense that the number of doctors leaving hasn't really been critical enough to create that shortage in Amuwo of the MCC. I don't know whether by design or by luck. I know one or two are still living, but by and large, we've been able to keep the large chunk of our of our doctors here in Amuwo, and that has not critically affected the services we render to our patients. But where we really had a lot of shortage from end of last year to the beginning of this year was the nursing department. Many actually resigned their appointment and left the country. But the Health Service Commission was also able to respond to that by employing new set of nurses to fill the void created by those who are going. So we are not doing badly in that area.
He goes further to say what Amuwo MCC is doing to keep its staff motivated to stay and perform optimally.
The condition under which we work here is much more friendlier, and we also take care in terms of the welfare of our health personnel is of paramount importance to us too. So we try to keep them happy doing what they are doing. So, but that doesn't mean that for those who still need to leave, they don't leave. But by and large, there's what we call our staff are also our customer. We have the internal customer and outside customer. Our staff like our internal customer, and they need to be happy for them to produce maximally and give out their best in terms of quality health service to people and all of things. So we are doing a lot in that area to motivate them, encourage them, and also appreciate good work or hard work when they have done well. So we recognize all those things, and I think that has also helped them. We've had doctors or nurses in the past that even for them to live here, they are sad living this day because they've actually enjoyed